The Doppler effect refers to the change in frequency of a wave when there is a motion between the sources and the observer. When the source moves closer, the frequency increases, and when it moves away, the frequency decreases. In medical ultrasound, the Doppler effect is used to study blood flow in the body. Ultrasound machines emit high-frequency sound waves into the body. When these sound waves hit moving blood cells, the reflected waves return with a different frequency. This change in frequency is known as Doppler shift. By analyzing this shift, doctors can determine the speed and direction of blood flow, helping them detect conditions such as blockage or abnormal circulation. Next, I will explain about a positive Doppler shift. A positive Doppler shift occurs when blood is moving towards the ultrasound probe, also known as transducer. As the blood cell moves closer, the reflected sound wave returns to the probe faster with a higher frequency. This increase in frequency is detected by the ultrasound machine. On the Doppler display, this flow is shown as a positive signal, usually above the baseline or in a specific color. This information helps doctor understand the direction of blood flow and confirm that blood is flowing towards the probe, which is important in assessing normal circulation. Next is negative Doppler shift. In Doppler ultrasound, a negative Doppler shift happens when blood is moving away from the ultrasound probe. The probe sends out sound waves, and when those waves hit red blood cells that are moving away, the encures return at a lower frequency than what was sent. That was, we say, the sound wave come back slower. So in this diagram, you can see the blood flow moving away from the transducer, which causes the wavelength to stretch and the frequency to decrease. On the Doppler display, this is shown as a negative signal, usually appearing below the baseline. So, whenever we see a negative Doppler shift, it indicates that blood is moving away from the probe, helping with accurate diagnosis and assessment of blood vessel. And why positive and negative Doppler shift are important? Because they help doctors understand how blood is flowing in the body. By showing whether blood is moving towards or away from the ultrasound probe, Doppler ultrasound helps identify abnormal flow directions. This is especially important in heart and vascular diagnosis, where it can detect problems like valve leakage, narrow vessels, or reverse blood flow. Understanding these Doppler patterns allow doctors to make accurate diagnosis and choose the right treatment.
Now, I will continue with what is color Doppler ultrasound. Color Doppler ultrasound is a special technique that allows us to see how blood flows in real time. Instead of showing organ in black and white, color Doppler adds colors on the screen to let us see how blood flows in the blood vessels. The color helps doctors to understand the direction and the speed of the blood flow. The most color code used is red and blue. The red color code indicates blood flowing towards the ultrasound device, and it is important to remember that red doesn't mean artery. The blue color code indicates blood flowing away from the ultrasound device, and it doesn't mean a vein. Another important point is the brightness of the color. The brighter or lighter the color, the faster of the blood flow, while the darker the color means the slower the blood flow. This helps doctor to quickly identify areas may be abnormal, such as narrow or blocked vessels. Next, I will explain what causes the color to change in color Doppler images. The first factor is the speed of the blood flow. When blood flow is faster, the shift will increase, and this results in brighter colors on the screen. The second factor is the direction of the blood flow. If the blood flow towards the ultrasound device, it will appear red. But if the blood flow away from the ultrasound device, it will appear blue. If the direction changes, the color also changes. The third factor is the angle between the ultrasound device and the blood flow. Color Doppler works best when it angled correctly. If it angled poorly, it may show color inaccurate or weaker, even though the blood flow is fast. Fourth factor is the turbulence in blood vessels. When the blood flow is smooth, the color may appear uniform. However, if there is turbulence in the blood vessels, it will show a mix of colors. This is often a sign of an abnormal blood flow. Now, I will move on to spectral Doppler. Unlike color Doppler that use color, spectral Doppler use blood flow as the graph. This graph allows doctor to measure the blood flow more precisely. On the graph, there will be vertical and horizontal axes. The vertical represents the velocity, which shows how blood flow is moving, while the horizontal axis represents the time, which shows how blood flow changes over time. Spectral Doppler is very useful because it allows doctor to accurate measurement of blood flow, speed, and patterns. Doctor can use it to assess conditions like valve problems and abnormal circulation.
Next, I will explain the types of Doppler ultrasound that are commonly used in medical imaging. There are several types of Doppler ultrasound, and each type has different function depending on the medical condition being examined. The first type is continuous wave Doppler. This type is used to measure very high blood flow velocities. However, it cannot determine the exact location of the blood flow. It is usually used in heart studies, especially to assess blood flow through heart valves. The second type is pulse wave Doppler. This type can measure blood flow at a specific location inside the blood vessel. It allows doctor to know exactly where the measurement is taken. However, it has a limitation when measuring very high velocities of blood flow. Another type is color Doppler, which has been explained earlier. It shows the direction and the speed of blood flow using colors, making it easier to visualize blood movement inside blood vessels. Lastly, there is power Doppler. Power Doppler is more sensitive than color Doppler and can detect slow blood flow, especially in small blood vessels. However, it does not show the direction of blood flow. Different types of Doppler ultrasound are chosen based on patient's condition and a diagnostic need. Doppler ultrasound is very important in modern medicine because it helps doctors observe blood flow inside the body without surgery. It is commonly used to detect narrow or blocked blood vessels, which can reduce blood supply to organs. Doppler ultrasound also plays a major role in diagnosing heart disease, such as problems with heart valves and abnormal blood flow patterns. In addition, it is widely used during pregnancy to monitor blood flow to the fetus and placenta, ensuring that the baby is receiving enough oxygen and nutrients. Overall, Doppler ultrasound helps in the early detection of medical problems, allowing treatment to be given as early as possible. In conclusion, the Doppler effect plays a crucial role in medical ultrasound imaging. Color Doppler helps doctors see the direction and speed of blood flow, while spectral Doppler provides accurate measurements of blood flow velocity. The Doppler effect allows healthcare professionals to assess blood circulation and detect abnormalities efficiently. This clearly shows how physics is applied in real medical technology, making Doppler ultrasound an essential tool in modern medical diagnosis. Thank you.